Well, Mr. Lee, first I need to get an overview of how your condition has developed. Can you just describe for me the initial symptoms?
Well, it's a long story and it took ages to get a diagnosis. It's been very difficult to cope with.
I totally understand your frustration.
There were quite a few symptoms, but I didn't connect them all at first. I had 3 or 4 separate lots of mouth ulcers in the space of less than a year. They were quite painful and I couldn't eat properly.
Okay.
I've occasionally had them in the past, but not as numerous and frequent as this. Then in June last year, I suffered from this really bad inflammation of both eyes. I went along to my optician and he gave me something for it and said it would settle down.
And did it?
Actually, yes. That's been one of the weird things about all my symptoms. They flare up and then sort of disappear after a while. And I rarely had all the symptoms going at the same time, thank goodness. Once or twice I came out in spots, and it brought back unhappy memories of acne when I was a teenager. Around the same time I noticed these slight skin lesions on my leg. The skin was red and felt very tender. Even after the swelling had gone down, the skin looked odd, quite discoloured.
Okay.
And it still is. I can show you.
Were there any other symptoms?
Well, I started getting these awful headaches. One of them really knocked me flat for a whole day.
Okay.
The only other thing was a definite stiffness in the joints. My mother had arthritis, so I thought I had the same problem too, but again, like a lot of the other stuff I'm telling you, it sort of went away without any treatment. At this stage, I was sure it was my diet that was causing all these problems and thought some food types might be triggering some of the symptoms.
And what did your GP say when you saw him?
He ordered various blood and urine tests, and at one point he thought I might have contracted Lyme disease because I do enjoy my walks in the countryside, and a couple of the symptoms seemed similar.
Mm-hmm.
The tests didn't point to anything.
Right.
I saw a different doctor and he speculated about possible lupus and explained what it was. He wasn't totally convinced, though. The lack of certainty was upsetting and just made matters worse.
And then you had further tests?
Yeah, the diagnosis became more definite when they did a pathogy test. I had such a strong reaction that it seemed to be like the final piece in the jigsaw puzzle.
Right. And then you were referred here?
Yes, and I've had to see various specialists to deal with the different symptoms. I was given some immunosuppressants straight away, though they did warn me that there was the possibility of side effects. I know it can be like that with almost every drug, but I didn't expect to suffer the way I did. Basically, I had a lot of abdominal pain, and would you believe it, some of my hair started to drop out.
Right. So that treatment was discontinued?
Yes, I was told that biological therapies would probably be more effective. Is that right? I haven't reacted in the same way to this new treatment, at least not so far. There have certainly been no strange side effects. I feel a little better overall.
Okay. Now, I believe you're seeing the ophthalmologist this morning.
Yeah, she's going to give me some corticosteroid eye drops. And the other urgent problem right now is getting to grips with the headaches. Your colleagues have put me on beta blockers. I'm hoping they'll prevent these headaches developing in the first place.
Yes, they should work well. Now, we just need to discuss your recurring joint pain and see what we can do to ease the...